You know that feeling, right? You get a new ache, a weird twinge, something just feels off, and bam, your mind just starts racing. Is this nothing? Or is this, something serious? We've all been there. And that uncertainty, it's so stressful. You've got this new symptom, a pain that literally wasn't there yesterday, and your head is just swimming with questions. So how in the world are you supposed to know when it's just a blip versus a real, hey, pay attention to me signal from your body? Well, that's exactly what we're going to tackle today. Think of this as your straight-up, no-panic guide to decoding women's health signals. Because honestly, knowledge is everything when it comes to your own body. So let's start with the big stuff first, okay?
All right, let's dive right into level red. These are the absolute do not pass go, non-negotiable emergencies. We're talking about signs that mean you need to get help like right now. Think ER, think urgent care. No waiting around, no second guessing.
Okay, first on this list, signs of a stroke. This is critical. If you see someone, or feel it yourself, with sudden weakness all on one side of their body, or their speech is getting slurred, or they just seem really confused, that is a massive, time-sensitive emergency. Every single second matters here. And it's the same deal when it comes to your heart and lungs. Things like chest pain, that terrifying feeling of being severely short of breath, or actually fainting. These are huge red flags. You just can't brush these off. Some other really serious ones to watch for. Heavy bleeding. And I mean so heavy it's making you dizzy. That is an emergency. Or what about really bad pain in your abdomen or pelvis, especially if you've got a fever or you're vomiting with it? Get it checked. And look, if you're pregnant, any bleeding or strong pain is your signal to get help right away, no question. Okay, let's shift gears from those big emergencies to something that's a part of life for so many of us, our cycle. And let's be real, it can be so hard to figure out what's just, normal period stuff versus a real red flag from your hormones that something's not quite right. So, what's the difference? Well, a typical cycle, you know the drill. Some mild cramps, it lasts a few days, it's pretty predictable. But the red flags, they're different. We're talking about pain that is just off the charts, periods that drag on for more than 7 days, or a cycle that suddenly goes totally haywire and irregular. That's when you pick up the phone and call your doctor.
And there's more. Other things to watch for are like missing your period for a couple of months when you're definitely not pregnant, or bleeding between periods or after sex, or maybe you're getting really heavy clots, even severe PMS or mood swings that just feel completely uncontrollable. All of these are worth bringing up with your doctor.
All right, from our cycle, let's talk about two other super important areas for our health, pelvic and breast health. And with both of these, the #1 rule is knowing what's normal for your body. That's the key.
So for pelvic and vaginal health, your body is usually pretty good at sending signals. We're talking about things like weird discharge, a bad smell or a strange color, or that annoying itching or burning that just won't go away. Pain during sex is another one, and you also want to keep an eye out for any constant pressure or pain in your lower belly, or if you find any new sores or lumps down there.
And right along with that is your urinary health. If it burns when you pee, or you constantly feel like you have to go, that's a sign. Seeing blood in your urine, definitely a sign to get checked out. And here's a big one. If you have back pain and a fever, pay attention, because that could be a kidney infection.
Now for breast health, knowing what to look for can feel really empowering. A super easy way to remember it is this 3-step check. Look, feel, and notice. So first, you look. Are there any changes to the skin, like dimpling or redness? Then you feel. Is there a new lump or maybe some thickening? Not just in your breast, but check your armpit too. And finally, you notice. Is there any weird discharge from the nipple, especially if it's bloody? Just having that regular awareness of your own body is so important. Okay, so we've been talking about very specific parts of the body, but what about when the clues are bigger? Sometimes the most important signals aren't just in one spot. They affect your whole system, both body and mind. So let's zoom out and talk about your whole body wellness. So what do I mean by whole body science? Well, think about stuff like major weight changes that you just can't explain, or that bone-deep exhaustion that doesn't go away no matter how much you sleep. That could be a classic sign of something like anemia or a thyroid issue. And sometimes it's a combo of things, right? Like hair falling out, plus acne, plus new hair on your face. That could be pointing towards a hormonal imbalance like PCOS. And we absolutely have to talk about mental health, because it is health, period. If you've been feeling this ongoing sadness or anxiety for weeks on end, or if stress is so bad it's wrecking your sleep or your appetite,
That's your body's signal to reach out for help. And please, this is so important. If you are ever having thoughts of harming yourself, that is an emergency. Please seek help urgently. You are not alone in this.
Okay, for our last section, let's talk about navigating health as we get older, in those midlife years and beyond. Our bodies are always changing, which means the signals can change too. It's just so important to know what the new things to watch for are. And listen, here is one of the most critical black and white rules in all of women's health. If you take away just one thing here, let it be this. If you are postmenopausal, any bleeding at all is not normal. It always, and I mean always, needs to be checked out by a doctor. No exceptions, ever.
And beyond that, there are other things to pay attention to. For instance, yeah, hot flashes are common, but if they're so bad that you literally can't sleep, that's worth a conversation with your doctor. Same goes for sudden bone pain or, memory issues that feel like they're getting worse. You don't just have to suffer through these things.
So, when you boil it all down, what's the big takeaway from all of this? It's really simple. Get to know your normal. Really learn to trust your gut when your body sends you a signal. And most importantly, you have to feel empowered to speak up and advocate for your own health, always.
Because at the end of the day, nobody knows your body better than you do. You are your own best advocate, your own #1 defender. The only real question is, are you listening to what it has to say?